Namaste, good morning, and welcome to Times Health Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give the best results to my patients through the combination of these techniques. Today, we are going to discuss about one of the most important aspects of the practice of yoga, that is synchronizing your breath with the movements. Okay, so what is the importance of moving with the breath? That is what we are going to discuss about today. I'm sure all of us, we understand when we are exercising or doing any form of exercise, it's very important to coordinate your breath with whatever form of exercise you are doing. Okay, that makes you more aware of the present, and it helps you build a good connection between the body and the mind. So today we are going to get into the depths of experiencing what is the magic of combining this breathing with our everyday movements. So today let's discuss and understand the details of it. Before that, I would like to tell you some ground rules that we follow when we are performing yoga. So the yogic asanas can be divided into different types, and depending on each type of asana, we can actually coordinate the breath. Okay, so I'm going to tell you which type of asana requires what kind of breathing. Please make a note of it. I have also explained the same thing in the last session, but I'm just going to repeat it again today. And then I'm going to explain to you what are the mechanics and why are we using this kind of breathing technique in that respective asana form. Okay, so let's divide the yoga asanas into different types. One is where we do elongation of the spine, that means lengthening of the spine. Okay, the second one is where we do forward bending or flexion of the spine. The third one is where we do backward bending or the extension of the spine. The fourth one is where we do side bending or the lateral bending, lateral flexion of the spine. The fifth one is where we do deep lateral bending or we side bend to a greater extent, that is again lateral flexion of the spine. And the last one is rotation, where we are actually doing a twisting movement of the spine. So what kind of breathing techniques we use while doing these yoga asanas? Let's make a note of these breathing techniques. During any kind of elongation activity, that is where we are stretching the spine upwards or we are lengthening our spine. Okay, whenever we are elongating our spine, we are going to inhale or breathe in while going into the pose. And while releasing the pose, so from coming back from this pose, we are going to breathe out or exhale. Okay, so this is the first thing. Whenever you are elongating the spine, you're going to breathe in. And whenever you are releasing that posture, you're going to breathe out. Okay, so that is one. The second one is nothing but forward bending or flexion of the spine, where we are kind of bending forward. Whenever we are bending forward, we are going to exhale or breathe out the air. Okay, why we are doing it, I'm going to come to that. But you just need to remember that whenever we are doing any kind of forward bending asana, we are going to breathe out or exhale. The next one is whenever we are doing backward bending. So backward bending or extension of the spine, we are going to breathe in, fill in air into the lungs. So we are going to breathe in whenever we are doing any kind of backward bending. Okay. Next one is whenever we are doing side bending, we are going to inhale or breathe in. So side bending, we are going to inhale, breathe in, and while releasing the posture, breathe out. Okay, so side bending involves inhalation or breathing in. But there is a difference. Whenever we are doing any kind of deep side bending, that means we are going too much into the side bending, that time we are going to exhale or breathe out because the intention of the posture is different. So whenever we are doing extreme side bending, we are going to exhale or breathe out. And the last one is twisting or rotation. Okay, whenever we are doing any kind of rotation, we are going to again breathe out or exhale. Okay, so twisting or rotation, we are going to breathe out or exhale. I hope this is clear to you. In which posture, what kind of breathing techniques we are using. Most of the times, these are the ground rules that are followed. There may be few exceptions wherein we are changing the breathing technique, but most of the times, these are the ground rules that we follow. If you know the reason why we are inhaling while extending the spine or why we are exhaling while forward flexing, you can write it in the comment box. All right. Okay. Before going on to the reasoning of why we are doing all these things, I would like to answer a few questions. So, Bharti ji, good morning. I have upper back pain for the last 20 days. I underwent a surgery before 2 months. Bharti ji, if you have undergone a surgery, one thing is that I need to know what kind of surgery or what joint has been operated or what area has been operated to be able to give you any kind of further insights. But whatever asanas we are doing over here or whatever, so you have to be very careful with them, especially if you have undergone a spine surgery. You have to be very careful with the asanas that you are performing. So always start with Sahaj Bhav asanas or very simple basic asanas or exercises. And if possible, take the help of a medical professional to decide what exercises or asanas you need to do whenever you are operated. So you have to be careful about it. Dr. Suresh ji, happy Sunday to you too. Shiv Shakti ji, good morning. Prasanna ji, from the past 3 months, I'm suffering from severe muscle and joint pains. Okay, so Prasanna ji, we need to figure out what exactly is the cause of this kind of severe muscles and joint pains. There can be a variety of causes. So you need to get probably your blood work done to understand what exactly is going within the body, to understand what are the what is the reason for this severe muscle and joint pains. Besides that, doing yoga with awareness and light movements, controlled movements can help you relieve this joints and muscles and joint pains. But you have to make sure that you get this properly assessed by a doctor. Murthy ji, I'm getting back pain in the lower rib. I did not understand that quite clearly. Are you getting the back pain in the lower thoracic area? You mean to say the lowermost rib is hurting in the back, right? If I'm right, please let me know. Okay. IGP, my left leg calf muscles get tight. So there are some stretching exercises for the calf muscles that you can do. You do driving daily about 50 kilometers. So that's quite a bit. And that's why you need to make sure that you are working out your legs well. So you are incorporating regular stretching and strengthening exercises for your lower limbs because you are driving so much. So it's very important. Also, before driving, you can start with little bit of warm up of all the joints of the legs especially, and after driving you can end with some regular stretches of the muscles and joints. I have pain when I sit or stand in my hip. I guess the last bone in the spine. So tailbone pain is quite common whenever it's a quite a common condition. You need to work on your core strengthening, your posture and other things. I have covered this in the back and spine video when I was doing it. So you can look into that and probably get some insights into how to manage tailbone and back pain, how to correct your posture while sitting, standing, etc. It's very important that you manage your posture if you are suffering from any such kind of pain. All right. Murthy ji, at the tip of the tailbone, the muscles are paining. Okay, so at the tip of the tailbone, sometimes when we sit in a wrong posture, that's what happens is when the weight bearing is on the tailbone, okay, that area starts paining. Okay, so you need to make sure that you have a correct posture whenever you are sitting and whenever you are standing. Okay, it's very important to maintain a good posture, plus working out regularly on your core muscles and your back muscles will help relieve this kind of thing. Okay. All right, so we are going to now understand why we are doing this breathing, okay? Why we are inhaling while extending and why we are exhaling while flexing, or elongation we are inhaling, okay? I want you to do an activity, okay? So I want all of you to sit erect and now try to breathe in deeply. Take a deep breath. Okay, so breathe in very deeply and exhale. Experience how much deep breath you are able to take. Okay, now what I want you to do is I want you to sit in a stoop posture and do the same thing. Try to breathe in deeply and exhale. Breathe in deeply and exhale. Okay, try to experience what is the change that is happening. You can write down in the comment box what was easier. Was the first one easier or this was easier? What was the difference between the two? Okay, so you can tell me whether sitting erect and breathing in deep, this was easier, or stooping forward and trying to breathe in deep, this was easier. Okay, so you can write it in the comment box if you have experienced what is the difference between the two. Samina ji, as we breathe in or extend our spine, we expand our chest and lungs, hence easier to improve our breathing. Absolutely correct. That's right. Nidhi ji, first posture, I got tired. Second one was easy. Okay. The first one was easier, Vidya ji says. Can't hear anything. There may be some issue with the system. You can check if the sound is proper in your system, because I think most of the people can hear me. Sheetal ji says no change. Okay, no worries. All right, so this were the different experiences that you have observed. Okay, so normally when you sit, yes, Kavish ji says first one was easier, Jaya ji says first one was easier. So most of you say first one was easier, which is absolutely correct, because in this position, when you breathe in, okay, so let me explain to you what is the mechanics that is happening. Okay, your rib cage tends to expand when you breathe in because the air has to go into the lungs. So your rib cage has to expand. Okay, it has to expand. The diaphragm, the muscle over here, breathing muscle over here, we have a muscle over here, it descends downward so that the lungs can inflate, they can become bigger. Okay, so the diaphragm descends downwards, the rib cage expands. Okay, what is there behind? The spine. Okay, so the thoracic spine. Now what the thoracic spine should do, it needs to increase the space. So what it does is it goes into extension. Okay, that is the normal mechanism of breathing. Your thoracic spine tends to extend, okay, or bend little backwards. So there is a slight extension in the thoracic spine. Okay, this is the normal mechanics when we breathe in. Okay, so normally when we are breathing in, all these changes are happening within our body. The diaphragm is descending, the rib cage is expanding, the thoracic spine is extending. This is the natural movement while breathing in. Whereas when you stoop forward and try to breathe in, there is no space for the diaphragm to descend in properly. Okay, it is stuck in the position. Even the rib cage, it does not have that much amount of space to expand. Okay, and your spine is already flexed or stuck into a position, so it becomes very difficult to inhale deeply in this position. Okay, it becomes a little difficult to inhale deeply in this position, whereas this position is comparatively very much comfortable while breathing in. Okay, so this is the reason, the exact reason why we extend. While extending the spine, we inhale, because that is the natural mechanics of the body. That is why in any kind of extension asana like bhujangasana, ushtrasan, okay, any kind of pose where you are extending the spine, you are going to breathe in, because you have to simulate the natural mechanism of your body. So whatever your body does naturally, you're going to repeat the same thing while you are actually doing the pose. But whenever you are breathing out, there is a natural tendency. The diaphragm, which is lowered down during breathing in, it will rise up. The lungs will shrink in size because they are throwing out air. The rib cage will also reduce in size. Okay, the ribs will lower down, it will reduce in size, and your spine will start bending forward automatically. That's the natural mechanism in our body. So whenever you are bending forward, you are going to exhale or throw out the air, breathe out. So any asana wherein you are bending forward, you are going to breathe out. Okay, so that's the natural way of breathing. I hope that is very clear to you. Okay, yeah. So Snehal ji says first one was easy. Bharti ji says first one was easy. Okay, Amitabh ji says when we stoop, our breath didn't reach deeper in the stomach. Absolutely correct, Amitabh ji. Good morning, Nivedita ji. So yeah, so do you understand why we are actually simulating the exact natural mechanism that is happening in our body? Okay, in the poses that we do in yoga. So it is very, very important that you do the same breathing style. You use the same breathing style whenever you're doing any pose. So for example, forward bending poses like Haspadasana, okay, Paschimottanasana, or Yoga Mudra, where you are bending forward, you are going to breathe out or remove the air out because the spine is flexing. Okay, so this is another important thing that you need to remember. Whenever we are going to side bend, we are actually opening the rib cage, okay, opening the rib cage from the side. So if we breathe in, we are pushing air into this part of the lungs, and it will help in opening of the rib cage much better. Okay, so we are going to breathe in whenever we are side bending. Okay, a shallow side bend, not a deep one, a shallow side bend, we are going to breathe in. Okay, because we want to expand the rib cage and stretch these muscles over here. Okay, whenever we are side bending. Okay, the next one is whenever we are twisting. Okay, so whenever we are twisting, if you see, you are actually compressing the muscles of the abdomen. Okay, you are also rotating the thoracic spine. Okay, so you are actually contracting all the muscles. Whenever all the muscles are contracting, what you're going to do is you're going to breathe out. It's like a squeezing mechanism wherein you are actually removing the air. So whenever you are rotating, you are going to breathe out. Okay, that's the natural way of doing it. It's very difficult to breathe in and then try to rotate. It's going to restrict your movement because you are actually locking your spine into a inhalation pose, okay, or extension pose. In an extension, rotation is not very easy. So while rotating, it's always better to breathe out. Okay, that's the next thing. Why elongating? Again, whenever you are elongating the spine or you want to create space between the vertebrae, what you're going to do is you're going to breathe in, because again here the intention is expansion. Okay, so you're going to breathe in. All right, so this is the natural mechanism. And the last one was deep side bending, where I said you have to exhale, because here the intention is not expanding the rib cage but stretching the lower aspects of the lower back and the hip. In that case, whenever there is stretching involved, it is always better to exhale out. Okay, exhalation will help in a slow controlled stretch. So this was the explanation of why we are doing what kind of breathing technique whenever we are performing any yoga asanas. Now let's experience how to synchronize our breath with our movements. So I would like all of you to do this along with me. Okay, whenever we are going to do an entire warm up, and then we are going to perform Surya Namaskar. Okay, that's an entire back and joint care flow wherein we are going to do various movements of the joints and the back. So we are going to do Surya Namaskar, and we are going to incorporate our breath with it and experience what exactly is happening within our body. Okay, so let's go on to that. We will start with conditioning first. So let's calm ourselves down so that we can synchronize our breath with our movements properly. Okay, so we are going to do conditioning first, and then we are starting with the warm up. So please be seated in whichever position you are in. Okay, you can keep your hands on your thighs. Look at one point in front of you. Now slowly close your eyes. Keep your spine as erect as possible and chin parallel to the ground. Focus on your body and your breath. Bring all your attention from anywhere else to your body and your breathing. Just observe your breath and your body. Do not try to change anything, just observe it. And slowly you can open your eyes and be ready for the warm up. All right, today we are going to do a warm up with breath synchronization as well. Okay, so the movements are going to be a little slower as compared to when we do warm up a little fast it is. But today the movements are going to be synchronized with the breath. Okay, so the first movement that we are going to do is taking our neck up and down. So again, while extending the spine, what we are going to do? We are going to breathe in. Okay, so inhaling, exhaling, inhale, exhale, inhale, exhale, inhale, exhale. Last time, inhale, exhale. Okay, so this was taking the neck up and down. Mind you, I'm not starting and completing the inhalation in the beginning itself. So I'm not doing and then moving. No, I'm not doing that. I am continuing my breath with the movement. That is very, very important. Okay, that you continue your breath. So from the start till the end, I am breathing in. And when I'm taking it down from the start till I reach the end, I am breathing out. Okay, so the movement is absolutely in sync with the breath. Okay, now we are going to do side bending of the neck. So we are going to inhale while bending sideways and exhale while coming back. Okay, so inhaling, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Last time, inhale, exhale, inhale, and exhale. Okay, so if you breathe in and breathe out properly, you will experience the entire movement clearly in your mind. Okay, if you are coordinating your breath, your attention is completely on the movement and nowhere else. That's the magic of coordinating breath with your movement. Okay, next we are going to rotate our neck. So we are going to exhale and turn. Inhaling, come back. Exhale, turn to the other side. Inhaling, come back. Exhale. Inhale, come back. Exhale, turn to the other side. Inhale, come back. Exhale, turn. Inhale, come back. Exhale, turn. Inhale, come back. Last time, exhaling, turn. Inhaling, come back. Exhaling, other side. Inhaling, come back. All right, so this was about rotation. Okay, now the breath over here, okay, it is not very forceful. Okay, it should not be forceful. If you do a forceful breath, you are going to start to feel dizzy in some time. That shouldn't happen. The breath is very calm and just synchronizing with the movement. That's all. The breath is very normal and calm when we are doing these movements. Okay, now we are going to stretch our hands up. So interlock your hands, and since it is elongation, we are going to inhale. Okay, so inhale and exhaling, get your hands down. Okay, again, inhaling up, exhaling, inhaling up, exhaling, inhaling up, exhaling, inhaling up, exhaling. Last time, inhaling up and exhaling, hands down. Perfect. Okay, so this was stretching our hands. Okay, next we are going to just turn our wrist up and down, again with a synchronization of the breath. Experience this movement very clearly, how beautiful it is. Okay, so we are going to just keep our wrist neutral. Now inhaling, exhaling, hands down. You can coordinate even smallest movements of your body with inhalation and exhalation. Exhaling down. Inhaling up. Exhaling down. Inhaling up. Exhaling down. Inhaling up. Exhaling down. Inhaling up and exhaling down. Perfect. Okay, so this was for the wrist. Now we're going to rotate our body. So twisting, so interlock your hands in front. Exhaling, twist. Inhaling, center. 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 Exhaling, twist. inhaling center. Last time, exhaling twist, inhaling center, exhaling twist, inhaling center, and relax. Okay, so this was twisting, hence we did exhalation. Now we're going to straighten our legs and we're going to just bend the knee slowly and straighten. Okay, bend the knee slowly and straighten. Okay, so since we are bending the knee and there is abdominal compression, we are going to exhale, and while straightening, we are going to inhale. Okay, so exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale. Last time, exhale, inhale, exhale, and inhale. Okay, now we're going to do the same thing in the ankles. So we're going to point our ankles down and up. Okay, so while taking it up, we're going to inhale, and while pointing down, exhale. Okay, so let's do it. Inhale and exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, and exhaling, relax. Okay, so this was the warm up. Now we're going to get up and we are going to perform the Surya Namaskar. Okay, so that's a joint and back care flow. Make sure if you're suffering from hypertension or high blood pressure, cardiac conditions, any spine surgery has happened recently, okay, hernia, okay, any kind of a slip disc or a spine fracture history you had, please do not perform this asana. Okay, it's not safe. So let's start with Surya Namaskar. I'm going to first tell you the steps of Surya Namaskar, and then we are going to synchronize our breath with the movements. A Surya Namaskar is complete workout of different joints of our body. It's a very good joint mobility drill. Okay, it's going to create a lot of lubrication in the joints and is a very beneficial asana when done on a daily basis. So we are going to start with understanding the Surya Namaskar and how to synchronize your breath with the different movements of Surya Namaskar. You will also get an idea of how the different asanas can be performed with breath synchronization when I do this. Okay, so first is just the steps of Surya Namaskar. I'm going to illustrate. So you stand in the front of the mat. Keep your feet together. Okay, we are going to start with Sthit Prajnasan first. So join your hands in front of your chest. Keep your back erect, chin parallel to the ground. Okay, stay there for 3 seconds. 1, 2, 3. Now slowly lower your hands and go into Hast Uttanasana. So you're going to stretch your hands up and bend a little backwards. Stay there. 1, 2, 3. Now bend forwards. It is Hast Padasana. Okay, touch the ground and stay there. 1, 2, 3. Now keep one leg forward. Place your hands down at the same place. Keep one leg forward and one leg behind. And slowly go into Ashwa Sanchalanasana. Your toes are on the ground and you are slowly extending your spine. Okay, stay there. 1, 2, 3. Now keep both your legs, hands over there only. Keep both your legs together, heels on the ground, and try to push your head down between your arms. Stay there. Adho Mukha Svanasana. 1, 2, 3. Now slowly lower your knees down, chest down, and chin down. Ashtang Namaskar. 1, 2, 3. Now slowly stretch your legs down, point your feet down, and go into Bhujangasana with your hands straight and looking upwards. Stay there. 1, 2, 3. Now slowly push yourself up again into Adho Mukha Svanasana. Stay there. 1, 2, 3. Now take your left leg forward and place it between your hands into Ashwasanchalanasana. 1, 2, 3. Now take your right leg forward, place it beside your left leg and keep bending forward. Hastpadasana. Now slowly come up with your hands and ears together. Bend a little backwards again. 1, 2, 3. Swing your arms, sweep your arms from the side and come back to Sthit Prarthanasana. Okay, so this is only half part of the Surya Namaskar. We're going to do the other half. Okay, so in the first round, we initiated from the right leg. In the rest half of the asana, we are going to initiate from the left leg. Okay, so let's do it. Again, up, bend backwards, 1, 2, 3. Bend forward, 1, 2, 3. Now left leg forward, right leg behind. Ashwasanchalanasana, 1, 2, 3. Now go with both the legs behind and heels on the ground. 1, 2, 3. Now knees down, chest down, chin down. Ashtang Namaskar. 1, 2, 3. Slide your feet down. Go into Bhujangasana. 1, 2, 3. Now slowly again go into Adho Mukha Svanasana. 1, 2, 3. Now bring your right leg forward. 1, 2, 3. Bring your left leg forward. 1, 2, 3. Take your hands up, bend backwards, and slowly come back to the starting position, Sthit Prarthanasana. Okay, so these were the different steps of Surya Namaskar. Okay, right now we did it with a normal breathing. Okay, but now we are going to synchronize our breath. Okay, make sure you're not pushing yourself beyond your comfort. Try to identify what is the comfort zone of your body. Try to understand your body as much as possible. Okay, you're going to work on your own body through your own understanding. Okay, so my body is different, your body is different. Every individual has a different type of a body. The more you understand, the better you can work with it. Okay, so now we are going to synchronize our breath with the movements. So now I'm going to tell you when to breathe in and when to breathe out when we are doing Surya Namaskar. Okay, I'm not including any holding or retention of breath because there may be many participants who may have some issues related to breath holding. So I'm just going to tell you when to breathe in, breathe out, and when to normal breathe. Okay, so we are going to work out like that. So let's start with it. Normal breathing over here. Now, breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, and breathe out. 3. Now breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. And breathing out. 1, 2, 3. Okay, so I hope this is clear how to breathe in and breathe out when you are performing Surya Namaskar. We are going to go for the other half. Again, remember when to breathe in and breathe out while doing the movements. Try to synchronize your breath as much as possible. So we are going to start normal breathing. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in and breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. And breathe out. 1, 2, 3. Okay? So it's okay if you go a little slower. That's fine. Absolutely fine. Sometimes what happens is you're not able to breathe in or breathe out throughout the movement. It's okay to normal breathe in between. But try to synchronize your breath as much as possible. All right? Okay? So let's go for one last round of Surya Namaskar again with the breath coordination. Okay? So again, standing in front of the mat, if you notice, my hands, once they are placed on the ground, they are in the same place till the end of the asana. Okay, that's how the Surya Namaskar is supposed to be done. Once you place the hands on the ground, they are in the same place till the end of the asana, and you're supposed to manipulate your limbs according to the position of your hands. Okay, so we're just going to do that. Legs together, hands joined on the chest. Normal breathing. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in and breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Let's go for the next half. So again, normal breathing. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale and exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. And exhaling. 1, 2, 3. Okay, so this was a complete joint care flow along with your inhalation and exhalation. Okay, if you are unable to bend forward too much, you can go up till the level you are comfortable and breathe in and breathe out accordingly. That's absolutely okay. So as per your convenience and as per the comfort of your body, you have to, modify the asana. But whenever you are doing the asana, it's very, very important that you pay attention, because with this kind of breath synchronization, you can actually work on the specific muscles of the body. So for example, when I was going into this position, okay, if I breathe in properly, I'm going to actually expand my chest and I'm going to actually create a stretch on the hip flexors, okay, as well as the glutes over here. And I'm going to actually expand my chest and extend my spine. So it's a very good way of doing the asana. Okay, your stretch will be absolutely localized when you synchronize your breath with the asana. Okay, so when you are exhaling while bending forward, you can actually, you know, leave your body loose and you can feel the stretch along the legs. Okay, so it's a very good way of stretching, okay, with the breath coordination. So make sure you are doing that. Okay, so this was Surya Namaskar, a total joint care flow. Okay, so that involves a lot of flexion, extension of the spine. Okay, it's a very good asana. Okay, now just to give you an example of a deep side bend with exhalation, okay, we are going to do Trikonasana, okay, Trikonasana 2. So here we are going to keep a distance of about 3 feet. Keep one leg turned outside absolutely 90 degrees. Take your hands to the shoulder level. Inhale and exhaling, bend sideways. Okay, so since this is a deep side bend, here the intention is not opening the rib cage, but stretching the lower back, okay, and the lower hip area. And inhaling, come back. Okay, same thing on the other side. Inhale and exhaling, bend. Stay there with normal breathing. And if you are able to suspend the breath, then you can suspend it. 3, 4, 5, 6. Inhaling, come back. And relax. Okay, so this was Trikonasana to a deep side bend, okay, which requires exhalation. Okay, so this is about the deep side bending, wherein you can incorporate your inhalation and exhalation accordingly. Okay, so once you do that properly, you will actually feel a proper stretch. And when you are breathing consciously, you can actually correct your body position more better. Okay, initially, maybe your attention will be totally towards your breath. But once you have become a little automatic on it, you will actually be able to stretch the perfect muscles. Okay, so we are going to repeat this again. So inhaling, take your hands up. Exhaling, bend sideways. 1, 2, 3. Now localize your stretch. Feel the stretch. 1, 2, 3, 4, 5, 6. Inhaling, come back. 1, 2, 3. Now turn the other foot outside and exhaling. Go down. 1, 2, 3. Stay there. 1, 2, 3, 4, 5, 6. Inhaling, come back. 1, 2, 3. And exhaling. 1, 2, 3. All right. So this was Trikonasana 2. Okay. Now we are going to just wind up the session by doing one breathing exercise. Okay. That is the diaphragmatic breathing. Just because I think Sunil ji said, my breathing is noiseless. I sometimes fail to distinguish between inhalation and exhalation. So this pranayam, that is Yogendra pranayam number 4, is going to actually help you understand your inhalation and exhalation much better. Okay. So for that, what we are going to do is we are going to lie down on our back. Okay. So always while lying down, make sure that you turn on your side and then lie down straight on the back. Okay. So keeping your knees together and feet apart. Okay. So you're going to keep your knees together and feet a little distant from each other. You're going to keep one hand on the abdomen, just below the rib cage. Keep the other hand by the side. And now slowly, first just focus on your breath, how you are breathing. Just try to observe that. Now, slowly try to inhale a little deeper and exhale a little deeper. As you inhale, your abdomen should rise. As you exhale, your abdomen should go down. Now I'm going to count 3 for inhale and 3 for exhale. Try to, coordinate your breath accordingly. Inhale, 1, 2, 3. Exhale, 1, 2, 3. 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 Relax and normal breathing. Slowly turn on your side and get up. So this is a regular practice that you can do in order to, make you ready for synchronizing your breath with all of the asanas. So this is the diaphragmatic breathing that you can practice on a regular basis. Okay, you will understand your inhalation and exhalation much better with this kind of pranayam practice. All right. So that is what you need to do. You can also synchronize your breathing in your daily activities. Okay, like for example, when you are walking, what you can do is you can take 3 steps of inhalation and 3 steps of exhalation. So as you are walking, every 3 steps you are inhaling, every 3 steps you are exhaling. You can actually synchronize your breath like that. When you are climbing stairs, probably you take 2 steps inhalation, 2 steps exhalation, 2 steps inhalation, 2 steps exhalation. You can also do that. Whenever you are getting up from the chair, you can inhale, and whenever you are sitting down, you can exhale. Okay, so that also you can do on a daily basis. This kind of synchronization makes you less prone to any kind of injury because you are well aware of your movements. Okay, it makes you more and more aware of your movements. Okay, so you can actually synchronize your breath in your daily activities. Well, like for example, whenever you are bending forward, you can exhale, and whenever you are coming back up, you can inhale. That will create a lot of core stability as well, because the diaphragm descends. As I already told you, the diaphragm descends. It creates a lot of core stability, so less prone to spinal injuries also. Okay, so as much as you coordinate your breath, that much safe the movements become. Okay, so you see how important it is to coordinate the breath with every movement. Okay, in other activities, like while speaking also, you can take a pause before speaking, take a deep breath, and then start to speak. That makes it one much more aware. Okay, breath actually gets your mind to the activity that you are doing. That's the connection between the body, between the activity and your mind. So it is actually causing a union of both the things. So you see how important breathing is throughout the yogasan practice, and how effective it makes to get all your attention to what you are doing. Okay, so that's how it becomes so excellent whenever you practice breathing with your movements. Okay, so I hope you are going to incorporate this breathing and bring all your attention to the present moment. Bring all your awareness to the movements that you are doing. You will be able to assess your body much better, understand your body much better when you are doing it with this breathing practice. Okay, and once you understand your body, then you can take the actions to make it more and more fit, more and more agile, to make it more and more better. Okay, so make sure that you are assessing your body, you are doing a self-assessment of your own body through these kind of techniques. It's going to help you a lot. Okay, in between, I'm just going to take a few questions. So Vidya ji, if you had a breakfast, it's not okay to do the exercise. You need to take a break of at least 2 hours so that the food is digested and you don't face any difficulties while doing the asanas. Okay, so yeah, so that's about coordinating and synchronizing your breath. Okay, it's a connection between the body and the mind. Okay, so it's going to help you a lot with uh, connecting your body and mind and bringing that coordination in your movements, that rhythm, that smoothness in your movements will come when you coordinate your breath. All right, so here's a task for you. I would like you all to perform this breath synchronization with your daily activities like walking, stair climbing, getting up from the chair, or bending forward in this week, and yourself experience the difference of how movement aware you become with this kind of breath synchronization. Also, do follow Times Health Plus on YouTube and Instagram channels, and also encourage others to follow it for tips and recommendation related to yoga. I hope I have added on to your knowledge of how you can move with your breath, okay, and stay in the present moment with full awareness. Uh, all right, so that was it for today. Vipinji, yes, this video is available on YouTube, Times Health Plus channel. You can watch it over there. So that was it for today. Now, please practice what I have given you and stay in the present, move gently, and make sure that you take care of yourself. Thank you and namaste.